Hello to Sarah and hello to everybody who's joined the seminar today. It's great to be with you. This is our first for 2026 and lovely to be with you, Sarah. And
Yeah,
welcome.
thanks for having me.
Yeah, I'll just say a few things as well, just by way of introduction, so people a little bit more on the picture of your background, the research, and so on. So you lecture in psychology at the Institute for Health and Sport at Victoria University, but you gained your PhD in psychology from Canterbury Christchurch University in the UK. And your thesis explored the effects of different amounts and doses of mindfulness programs and practices to find out which are most helpful for individuals. And also to see how evidence-based mindfulness programs and practices can be made more accessible to increase well-being in society. So today we're going to be exploring questions like how much mindfulness meditation is enough. A lot of people are interested to know that. What's the minimum I can get away with and still get the benefits of it, or can we do too much? Does it really depend on the reason for which we're practicing it? And which is questions like which is more important, the meditation practice or being mindful in day-to-day life? So we'll explore some of those things. So Sarah, the first thing I'd like to know a little bit more about was, but did you personally practice mindfulness when you started and were doing your PhD, or and if so, how did it help you to get through that sometimes traumatic experience of doing a PhD in the first place?
Yeah, yeah, doing a PhD is a journey, I think, for many people. Absolutely. So I started my PhD because I was working as a research associate in a clinical psychology department, doing a lot of data analysis, quantitative data analysis, stats and stuff. And during that, I participated in mindfulness-based cognitive therapy, which is the 8-week MBCT course, and learned some meditation from there. And I was really interested in how that can be incorporated in busy lives and things like that. But I found it quite intensive as well because it's 8 week and there's a lot of daily practice. There's 50-minute practices to complete every day, which was great. I really enjoyed them, but I had quite a commute at the time and I was working further away, so it was quite difficult to fit in. Um, I then also did another program. So this is back in 2017 because I really, really enjoyed it. And the program I actually did was yours, Craig, Mindfulness for Wellbeing and Peak Performance. So this is like way long before I knew you, this 2017 or so. And I really enjoyed it. And I thought it was quite interesting how different these two programs are because they're both saying similar things like they're there to help improving well-being and performance, and MBCT in particular was also developed to reduce depression and help with anxiety and things like that. So I found it really, really interesting to engage in these practices, but at the same time, I thought, wow, these are quite different and they're doing the same sort of thing, right? So they're saying they're therefore improving these things, but the dose itself or the amount of practice you're meant to be doing is quite different. So that's how I first started getting into it. And then I thought, well, no one's really looked into why that is. And I thought, oh, I might as well do a PhD on this. How hard can it be, right? So I thought I'll start looking into that. Turns out fairly difficult. Um, but yeah, so that's a little bit of a background how I got into mindfulness and dose and understanding that question.
Yeah, and it kind of perhaps where the programs were developed from, because when John Kabat-Zinn developed MBSR,
Yep.
people with severe chronic pain and so on, there's a different cohort to when I was working with people in general practice. They're just coming in and just dealing with the normal stresses of day-to-day life and perhaps don't have the level of motivation to put in 40 or 50 minutes a day of practice. And I developed mine for John Kabat-Zinn just coming from that angle. What's going to be doable? What's going to be achievable? But I guess we'll get to the questions of, well, do we know? Does it matter how much you do? But so you really came to it, and did you find it of personal benefit when you were doing your PhD and coping with all of that? What sort of benefits did you derive from it?
Absolutely. I think it's really helpful in the sense that mindfulness is really present moment focused. So you're just thinking about the presence, what we're doing right here. So doing a PhD, certainly for me, and I'm sure many other people would have experienced it, there's a lot of worry about the future, or what's going to happen when I have my examination? How am I going to publish this paper, about the future? I mean, this is probably very similar in any job, in any environment, what's going to happen is a high stress time. But also sort of worrying about the past and things that have happened before. And did I do that meeting right? Should I have done this differently? Should I have looked into that a little bit more? So I found mindfulness quite helpful for that sort of just trying to stay present, non-judgmentally, sort of just focusing on where we are at the moment, especially during that really stressful time because I was working at the same time as doing my PhD, and then mindfulness has been really, really helpful to just sort of take a step back rather than let your mind run away with you with itself. So I think, yeah, absolutely.
Yeah. So we've sort of used the word dose already a few times, which is sort of like borrowed from medicine,
Yeah.
medications, and so on. Not meditation, but what do you mean by meditation dose?
Mm.
Is it just the amount of time that you practice when you practice, or how often you practice, once a day, twice a day, every day, 2 times a week? Or like, is it all so what do you mean by meditation dose?
Yeah, it's a good question. I mean, dose has these pharmaceutical connotations, this medical connotations, right? Because it's kind of like the dose of medicine is the thing that you might think about it. I thought about what to call it for a long time, because it is incorporating several different elements. So it's not just the amount of practice that you're doing. So, the length of a single practice, the length of practice overall over the course of an intervention, but it's several different elements related to what it is you're doing, because all of these elements kind of interact and are part of what it is you're doing. So you've got things like the single mindfulness practice, the cumulative practice amount. So if someone practices 5 minutes every day for 7 days, that's a lot longer than someone practicing for 20 minutes one day, once a week, right? Also, other elements like how long is the program? Is it 8 weeks? Is it 4 weeks? Is it 3 weeks? Is there a retreat included? So are people doing a day-long meditation retreat or several day-long meditation retreats? Other aspects as well. So who's the teacher? Is this, a qualified mindfulness practitioner? Is this in person? Is this online? Is it via apps? What's the delivery of that? There's also a group element in many mindfulness programs. So is it delivered via group and you have a group discussion afterwards to share your experiences? Is it one-on-one? Is it bibliotherapy? So there's also mindfulness programs that are delivered via books and people can listen to the audio guides as their homework. So there's just a lot of different elements that are cumulatively I refer to as dose, just because there's not really a better word for it. So it's that all of these different elements that can inform that mindfulness program, and what is the most helpful thing and for whom is also another question relating to that, right? So it's all of these different things that I've looked into, which is probably a little bit ambitious because there's too many things I've learned. I think any academic or any researcher finds out things and then we know what we don't know yet, and then there's so many more questions afterwards. I think, which is the exciting thing. I like questions.
Yeah, so it sounds like, like with medication, you can deliver it in lots of different ways, not just a pill, but,
Yeah.
same with delivering, meditation training. So you had so many different parameters there that you were trying. I mean, that's a lifetime of research, I suspect.
Yeah, it will. I think so, and I think that's what's happened by mistake. Because I think as well, what I started with is just looking at all the different papers. Because I think I was quite interested because no one had looked into it. So there's all these many programs available, and many listeners will have heard of those. There's mindfulness-based cognitive therapy and mindfulness-based stress reduction, so MBSR, MBCT, which is 8-week programs in person mostly. But there's all these mindfulness apps as well. There's online programs such as the one that you've developed, Craig, as well as all of these other programs. And they all say like, oh, this is really helpful for well-being and for concentration and for stress reduction and things like that. which I found quite confusing looking at it. And this is another reason why I want to do this research a little bit more for people that haven't done a lot of research into mindfulness or don't know a lot of things, which of course makes sense to sort of see what's the most helpful thing, what's the thing that can be helpful, what's the thing that is what I need to do for it to have a certain outcome. So that's also why I wanted to look into that a little bit more. So I did a large scale comparison of all of these different elements, and generally found there's not really a dose response relationship. So that means that longer programs can be helpful for people, but also shorter programs can be helpful. There's a difference in who the practitioners are as well. Are they new to mindfulness? Is this the first time they're sitting down to practice? Is this an experienced meditator, like someone with 20, 30 years of experience, other things like, are there mental health difficulties? Are there other difficulties? Is there some cognitive decline? So people have done mindfulness with dementia populations, for instance, as well. So there's all of these different elements. And unfortunately, there's not a one size fits all solution, it seems. There's not an easy answer with mindfulness, which is frustrating, but also exciting. I think that's quite an interesting thing to have found, I would say.
Were there any sort of, I mean, we can't say conclusion because that would sort of imply that, oh, the question's been answered, definitively and beyond doubt, 8.6 minutes twice a day,
Yeah, yeah, yeah.
whatever is it. Um, but were there any particular things that you kind of found, like signposts pointing in a particular direction, saying this is the kind of ballpark we're looking at, or this tends to be better than something else, or more useful or effective? Or was it
It's
just at the end, it's just like I came in with one question and I've left with 100?
I mean, that for sure. Yes, definitely. There's different ones. I think it depends on, so I did a study looking at people new to mindfulness who've never done any mindfulness before. And I looked at the length of a single practice because that's one of the doses, right? So how long is one practice? And for that group, shorter practices were found more helpful because they'd never done any mindfulness practice. So they had a greater reduction in stress, and a greater increase in their overall general trait mindfulness, which was quite interesting. So shorter practices seem to be more helpful to start with for novices, so for people new to mindfulness, than longer practices. But again, it really depends on what the context is of the program. So this was a program where people were practicing by themselves rather than in a group. So if there's a group program, maybe longer practices would have been more helpful, right? So I think one of the difficulties with the dose question is that it really, really depends on who the people are that you're working with. You know, another large part of it is that things like mindfulness programs are often quite expensive to participate in for people. And one of the things that I'd like to do or sort of is the aim of my research is making it more accessible for people as well, right? So it's all well and good to have a really nice long program that works for people, but if it's not accessible because it's too expensive to participate in, or there's travel involved, or there's other difficulties, you can't be away from family or something like that, then a different kind of program might be helpful for that person, right? So we can't really take the individual out of the context as well so much because there's a lot of different elements that would go into it. So it doesn't really answer your question because I think it just really depends on the circumstances.
Well, individual factors must matter a lot. Like, in having run mindfulness courses for many, many years, you get a sense that some people come into a course and like they're just ready, they pick it up and run with it. It's like, and I'm not sure if it's a motivation thing, if it's a kind of intention with which they practice, but like people seem to derive a lot of benefit quite quickly, whereas other people kind of less so. I
Mm.
so I mean, when you average it out across a group, I mean, it must be very hard to say because it might be quite individual. Did you find anything to point in that direction when you were doing your your
Oh,
research?
absolutely. So I did a study recently last year. I've analyzed parts of it and I'm still further analyzing it, looking at personality as individual differences. So whether individuals like different doses of mindfulness practice. So I started with the length of the practice again, whether that would differ depending on their personality traits. So if someone's more extroverted, what kind of practices would be best for them to start with. If someone's more introverted, if someone's more neurotic, what is best for them. If someone's more agreeable or less agreeable, right? So there's different elements to that. I actually found that there's a difference in what people find more helpful to start with. So again, this is novices, right? So I want to see as well, because people are being are quite different. So that's the main thing about psychology, I feel like, is that people are different. Different things work differently for different people.
Mm.
That is what I found, and I want to follow it up with larger scale trials, right? So seeing whether based on personality or other individual difference or context or other elements that are different from person to person, what might be a good way to start a mindfulness practice.
Mm.
So absolutely, and there's already some findings relating to that, and potentially in the future, also what I'm wanting to look at is whether we can personalize mindfulness programs based on these different elements as well.
Yeah, just touching on briefly on one of those things you mentioned, is it easier for somebody with a sort of a tendency for introversion to practice meditation and practice for longer than maybe somebody more extroversion? Is that would that was that part of your findings?
Yes, it was. So generally, someone was more extroverted. Generally, if I felt like briefer practices might be a good way to start. Now again, it kind of depends, right? Because it's you're not either or extroverted or introverted, right? It's a bit of a continuum there as well, which is often said. So I think it really depends on that as well, right? So it does seem like there is a trend in that direction though. And then we need to do some more larger trials to really look into that a little bit more. Um, but yeah, it's already kind of being established that there's differences in effectiveness already based on personality.
Yeah. So does a does the optimal dose and I suppose that's a like in different situations a different dose of medication might be helpful. And is it the same with meditation that if you're trying to deal with maybe significant recurrent depression or major chronic pain or significantly life-threatening illness, is a larger dose required to deal with those really things that just can turn your internal and world upside down, compared to, "Oh, I just want to do mindfulness to help me focus a bit better on my study, to help me to you know keep it cool a bit better in meetings, etc." Is there, does it really depend on the person's need?
Absolutely. And that's another point as well, what people's goals and motivations are to practice. Actually, Kevin Berryman and I are looking into that a little bit in the future as well. So one of the things that there's been a lot of research with longer programs being really helpful for things like treatment-resistant depression. So people who have tried different things already, different medications, that mindfulness has been found quite helpful just because it takes care of that ruminative element that people with depression often experience. So it's very present moment focus and helping with that. Um, Similarly with some other difficulties that people might be having, longer practices absolutely can be really, really helpful with that. Um, I think what the lower doses of, like lower um, engagement or lower practices, maybe doing them online rather than in person, takes, really focuses on as well as this improving well-being and improving those sorts of aspects of everyday life. Everyone is stressed in everyday life, and getting that sort of used to doing those sorts of practices or just being more present in daily life. If you're engaging in mindfulness practices has been found really helpful as well. So absolutely there's a difference in um, what people are needing and what is most helpful for them. But there's still not a definitive answer in that area. So we're still looking into that.
Yeah, but people will often say be resistant to regularly practicing meditation.
Yep.
You know, just don't remember, or if I remember, I'll do the washing first or something else, and all
Yeah.
sorts of ways of avoiding it. So, and we talk about being mindful while exercising, going for the walk in the morning, being mindful while, driving your car or any other time. Can't I just practice that? So the formal practice of meditation, and the informal practice of being mindful in day-to-day life. Do we know is one or other more or less effective? Is the whole game to just use meditation to help you to be more mindful in day-to-day life? Do you need meditation? Do you have to have it to do that? Is there any light to shed on any of those questions?
Absolutely. We've just done a trial actually with you, Craig, which is great. So we have a 5-week trial that we did is where we assign people to different groups. So we had 4 different groups. One group only received formal mindfulness practice instruction. So that's guided practices by a mindfulness teacher. Then there was one group that only received informal mindfulness practice instruction. So things like being present in daily life, like you were saying, Craig, paying attention to what it feels like when you're walking, what your feet feel like on the floor, things like you're brushing your teeth, you're paying attention to those things, just being really, really present in daily life. And we had another group that received instructions on both, so both formal guided practices as well as presence in daily life. And then we had a control group as well, because we wanted to look into exactly that, what's the kind of thing that's most helpful, and what are people actually doing, what's people's engagement with these kind of practices. And actually what we found is that it seems like a combination of both is the most helpful thing, not only for things like improving how mindful people are feeling, how they're engaging with the practices, but also if they're going back to completing the practices. So people are more likely to continue practice in what we found in this small trial, if they receive both formal and informal mindfulness practice instructions, right? So it seems like they're doing slightly different things. So the formal practice instructions where you purposefully sitting down and practicing, oftentimes with an audio guidance. And then the informal mindfulness practice, just looking at something slightly different where you're just being present in daily life. And it's probably the case that they're complementing each other, right? So informal mindfulness practices just remind you to do these purposeful sitting down practices. And vice versa. So purposely practicing also informing being more mindful in daily life as well. Yeah.
So like with exercise, if you take the stairs at work on a regular basis and whatever, you'll get fitter doing that. I suppose
Absolutely.
you call that informal exercise, but if you go to the gym and do some concentrated work in the gym, so each will complement the other kind of.
Yeah, absolutely. Yeah, that's a great analogy actually, because you're more likely to take the stairs maybe if you feel like you can because you've put in the work on the machines as
Yeah.
well. Yeah.
Yeah, we found with our medical students that, and the motivation to do formal meditation practice, like they all get the program, it's part of their curriculum, but
Yeah.
the motivation to do the formal meditation practice is a little bit sketchy. I mean, most students will do some meditation, at least once a week.
Yeah.
But what we found was when we measured it that the amount of informal practice, so how much they practice being mindful in the other 23 hours and 55 minutes of the day,
Yeah.
that was actually very, very telling for increases in mindfulness, trait mindfulness, but also in their well-being and study engagement as well. So, but yes, as you said, it's very early days in terms of that research at the moment.
Absolutely. And there's just so many more questions and things, and also just this part of getting people to practice. So the goal is to get more people to practice mindfulness, and how can we facilitate that in a way
Mm.
that works for them. So I don't want it to be something that is just a mindfulness practice to be just something that's for some people over other people. So the people that have the resources to practice it should be something that everyone can benefit from, and that can be rolled out and to make made accessible for everyone. And it seems like from the the research I've found so far, it seems like there isn't really a difference in effectiveness depending on the dose. So it seems like doing longer programs is helpful. There's heaps of research on that, but also doing shorter practices can be helpful, especially for people starting out with mindfulness because it overcomes that barrier to practice or getting used to practice, like you were saying. So an analogy I use sometimes, and I don't know if it's a perfect analogy, is if you imagine someone running a marathon, right? Or wanting to run a marathon and they've never done any running before at all. You wouldn't want them to run the whole thing, however long that is, 42 kilometers. I've not done one, clearly.
42.2 or 42
It's
kilometers
long.
and
Yeah.
195 meters.
And like 30 miles or whatever. I don't know. I don't know miles. But I think you wouldn't want them to run the whole thing the first day they put on their running shoes, right? So you're maybe starting with 1 kilometer, maybe 5 kilometers, then 10 and so on. Um, if you want to run that marathon, but also if people just want to do running for the general fitness rather than run a marathon, there's public health research saying that running 5K 3 times a week is also really helpful, for general physical and mental fitness.
Mhm.
Um, so it's again that depending on what people are wanting to do with mindfulness. But I think getting people to practice, even if it is starting with smaller doses, is a really, really, really helpful if it means that they can receive some benefits from that. And you can always increase or change it later on. And I think that the non-judgmental element of mindfulness is quite a helpful one in that regard.
Yeah. Another question, perhaps related, is the quantity and the quality of
Mhm.
practice. Like with exercise, you could go up to the pool for half an hour, and for half an hour, and could see guys up there and they've got the paddles on their hands, they're working hard, they're doing reps, they're really, and somebody else, swim 25 meters, sit there and just rest at the end for a while, like, and so there's a big difference in the amount of effort, um, commitment to the practice while they're there. Is it the same with meditation? What do we know about the quantity versus quality? Like, is the quantity, a longer practice in meditation, really useful if we're just thinking about, oh, I've got to go shopping later on and got to do this and got to do that, and not really that much, about coming back to the present moment, etc., compared to somebody who's really, and again, trying, practicing, but not with that kind of criticism, but just is sincere in terms of, that commitment to coming back. So what about quantity and quality?
That's another thing I've been looking at because I feel like I have a lot of work ahead of me because I think that's another that's another element I've been wanting to look at because the quantity is quite easy to measure, right? Easy-ish to measure, but we can say how many minutes did you practice today formally. Informal is slightly different, but we'll get to that. Um, the quality is quite an interesting one because as you say, we don't know what people are doing. So actually what I did is with colleagues in New Zealand and Tasmania and Sydney, we developed a measure called Mindfulness Meditation Practice Quality Scale. I wanted to call it the Down Under Mindfulness Questionnaire because that's more funny. But anyway, so it's the Mindfulness Meditation Practice Quality Scale, but it's looking at different things. So people complete a practice and then they're being asked questions related to the specific practice that they did. So we develop different measures depending on what kind of practice people were doing, right? So things like concentration type practices where people are able to refocus their attention to the object of concentration. If we have Vipassana type insight practices, where they're able to pay attention to different parts of their body, and so on. So we've got questions related to that. And the reason why that's important is because they complete it afterwards and then hopefully speak to maybe their teacher if they're not sure about some of the things they were doing during the practice and can really highlight the elements of where they're confused maybe of what they're meant to be doing or something that they're unsure about or something they need to work on a little bit more. Because as you say, just putting in the hours is not necessarily ideal if it's not done properly or done right. And I think that's why it's also really important to have qualified teachers or teachers that are able to give feedback on the practices that people have been doing, or any programs that have been developed need to be evidence-based programs. So a program that you were doing, as well as the mindfulness programs that are out there that are evidence-based, are really, really great at that. But unfortunately, there's also now a lot of non-evidence-based mindfulness programs, which can actually be quite harmful for people because they might not be looking at the quality of practice so much, right? So absolutely, the quality is really, really important. Um, we're looking at informal mindfulness practice and developing a measure with people in the US. I'm developing one at the moment, which is also a little bit more complicated with how that's done, just because it's not formal practice. It's not because it's during your daily life, right? But that's another element we want to really be able to understand that better, rather than just the quantity. It's also the quality. So because that's another element of dose. As part of that large list of doses.
Yeah. Another question I wanted to ask you was, I mean, we've used exercise as a kind of a metaphor a lot during this conversation, but people sometimes experience runner's high when they're going on a run. I didn't experience it very often, but moments when you do, it's a beautiful thing, and. But in the same kind of way, for many people in meditation, sometimes you can have a peak experience in meditation, but more often than not, mind wanders off, come back, get irritated with ourselves, practice being gentle with ourselves, and and it doesn't feel like a peak experience. It's just like the effortful practice of, hopefully working towards effortless practice of coming back. Do people need to have a kind of peak experience for meditation to be useful? Because a lot of people get preoccupied. If I don't have that, I'm not doing it right. I've read about it in books and stuff. I mean, it kind of seems to me like if running or doing something else, that you still get the health benefits whether you have a runner's high or not. The health benefits still come. How is it with meditation?
I think that's a good question, because I think people's minds are quite complicated. So you wouldn't have the same experience every time you do a meditation. So sometimes it might just be really, really hard. Some days it might be easy for you to focus on present moment experience. But maybe in particular on the hard days, that's especially where you need it, right? Because you're building up that sort of muscle. And John Kabat-Zinn said that about mindfulness being a muscle that needs to be exercised, right? That you need to build up. And especially also it can really help with moments of difficult times. So you've got that tool in your toolbox where you're not immediately answering or immediately jumping on something, but sort of just being really present and noticing sensations in your body a little bit more during that time. So certainly in meditation, you can experience a sort of equivalent to a runner's high, but it doesn't mean that you need to have that every time. So it's just sort of taking that back a little bit, just noticing what's going on in the body at the moment. And it might be noticing difficult times, right? Because this is not to make you a perfect human who's never experiencing any difficulties. It's just noticing that and trying to feel okay with those experiences in your body, in your life as well. So I'm not sure if that answers your question on the runner side.
Well, I've often felt that, sometimes practicing can be difficult, days can be not easy, sometimes feel, and especially if somebody's learning to deal with recurrent depression or something else, it can be some tough days, but I often feel like those more difficult practices can be the most useful. Still practicing being present, attentive, but really practicing the non-judgmental, non-reactive attitude to that. A little bit like I'm looking out the window there, and and there's a bit of a gale howling today. And if you're learning to sail, if it's an easy day, gentle breeze, water's smooth, it's all easy, it's lovely and pleasant. But you really hone your skills in sailing on the rough days. And if we want to learn sailing, then the rough days are welcomed.
Yeah.
And perhaps
It
it
makes,
could be the
yeah.
same with meditation as well.
Yeah, absolutely. It makes it more interesting as well. So things that overcoming difficulties is another practice that's used quite a lot, right? In mindfulness. And that's quite a good one as well, just because, as you say, that's
Mm.
in your life, even if everything is going well, there will always be difficult times or external circumstances, especially in the world at the moment. There's so much uncertainty and difficulties that we can see. And just taking a step back and understanding
Mm.
um, our responses to it, and it's okay sometimes to have difficult experiences because it makes us humans. It's not We're not meant to push that down. We can experience that as well. And having difficulties with meditation is one of the things. Even long-term meditators have difficult experiences with
Mm.
meditation sometimes, and that's okay, right? There's not a competition of,
No.
oh, get me to equanimity really fast or anything like that, you know.
Yeah, and trust ourselves sometimes if we feel like really can't practice, we're not trying to do ourselves a harm by forcing or imposing something, or maybe a mindful walk, do something physically active or whatever. So we've got to trust ourselves or get some guidance and support, about how to work with things. But well, I think we've covered quite a lot of ground, Sarah, and I think we've hopefully got a bit of time for some questions from our participants today. So I'll invite Jakob to come back. And Jakob, have we got any questions that we can put to Sarah? You all right with this, Sarah?
Yeah, that sounds great.
Yep, good.
Hey everyone, fascinating. Thanks for the great conversation you've had. We've got quite a few questions and comments in the Q&A. Feel free to put them in if you've got more. I want to start with a couple of questions that I think comes up very naturally when discussing these things. So first we have one here which says very simply, I'm a pensioner with mental problems. How much meditation should I do? Like what can you say in answer there?
I think that's always that's the tricky question, right? That's the main question that we want the answer to. I think however much you think is helpful, I think with finding it difficult with mental health, being gentle with yourself, not saying like I have to practice an hour every day and really force that is not going to be super helpful. So maybe starting with brief practices, even if it's 5-minute practices. There's also different kinds of practices that could be helpful. There's things like loving kindness or metta practices that can be really helpful with just developing some self-compassion and kindness with that as well. So starting slow sometimes can be really helpful, especially if there's mental health difficulties already. And you can always change it later on as well. So there's not an easy prescription answer, I would
Let's
say.
start with something that feels achievable and so on, and maybe with a view over time to building up as you
Yeah.
experience, maybe a few minutes a couple of times a day or that kind of, yeah. Mm.
So a related question here is from Cherie, who says, a question I have is, what's the recommended dose for children and the elderly who haven't meditated before? So a little bit in the same vein, but what if you haven't meditated before? Should you start with 30 seconds or 40 minutes, or what should you do?
Yeah, I think, wow, that's maybe 30 seconds is quite brief, but even even there's 3-minute practices that people are doing. A lot of that, if you've never meditated before, what can be quite helpful is um just focusing on your breathing is quite a good question. So most of the time the breath is available to people. Just sort of taking a step back and focusing on breathing, doing some practices. So Craig's got some really great ones as part of their program, right? Where there's briefer practices as well, or there's like mindful minute practices, and that could just be a minute of just focusing on your breath. And then there's other practices that can follow that as well. So it's never just, they're just doing one thing. So trying out a few different practices, just really making sure that the practices you're doing are from teachers that have researched this, and it's an evidence-based practice would be really, really important. You know what you think, Craig?
Yeah, but I've heard somebody, I mean, I haven't worked a lot with young children, although sometimes I get asked, but like, for a child that's 6 or 7, 2 minutes is a long time. So a little 1 minute or 2 minute practice, is a great place to start. And by the time getting to 10 or 12, then maybe 5 to 10 minutes. I mean, it depends on what a child's built up to, but the younger the child, from experienced practitioners there, the briefer the practice and build up over time.
So there's quite a few comments and questions about mindfulness and other kinds of practices. We briefly mentioned just now compassion training and so on. So here's one from Kevin who says there's a lot of talk about mindfulness practices, but is there any research out there about how different kinds of practices like self-compassion might require different doses, or whether they might be suited to different kinds of people? And other comments also say, what about different traditions like Vedic traditions or yoga and so on? What is there to say about that? Or is it just focused on mindfulness?
No, I wouldn't be just focused on mindfulness. So it's with all the different traditions. I mean, with meditation, there's just a lot of different types of meditation being the umbrella term, and then there's mindfulness meditations, there's loving kindness meditations, there's Vipassana insight meditations, samatha practices, which is concentration based. So there's lots of different and many more as well. I won't list them all now, but absolutely. So there's different doses or practices that people are doing. Even things like movement practices like yoga can be really helpful. And again, it would depend on the context as well. So what is it that the person would find most helpful at that point? Maybe there's an injury as well. So we need to loop back in. So the main finding related to the dose, or the main message, is kind of like there's not a one size fits all solution with this. So it really depends on who the person is that's practicing and how they're practicing and what their motivation to practice is, or what is the thing that they want out of it, what is the difficulty that they're struggling with, and people are quite different in that as well. But generally, mindfulness is quite helpful for people. For some people, it's not helpful, and that's okay as well, right? So that it doesn't need to be something that is a sort of panacea for everything. Other things also need to change, but it can be quite helpful for that present moment focus.
And Gemma here says, what's considered a shorter practice or a longer practice? Just as a kind of way to begin to think about this.
I mean, there's different viewpoints on this. I think so. Shorter practices. I mean, there isn't one point at which point it becomes a longer practice, right? Because people will be very different. For some people, an hour practice is a short practice, right? So that really depends on who you ask. In my research, I've done 5-10 minute practices, or maybe even 3-minute practices can be considered shorter practices, and sometimes 20+ minutes can be longer practices. Some people say 45 minutes is still short. So it really depends on who you're asking. I would say that if you're doing, don't worry too much about is this a short practice or a long practice? It's just, does this work for you? Would be the most important thing to be looking at.
I often use a metaphor of punctuating your day. And like with, say, full stops and commas, a comma might be just a minute of just the practice. It could be shorter, though. You're about to get off your chair and go to a meeting, for example. You might just have 15 seconds to just stop and just be present so you can move into that meeting. So these practices can be very short, but they'd be little commas to punctuate the day. A full stop might be 5 minutes or 10 or 20 or whatever, but life without any punctuation is like mindful punctuation is like reading a book without punctuation. It just becomes a blur and meaningless, I think. And so I don't think there's any kind of, can be long, short, can be whatever suits the moment, really.
Got two more questions around this issue of length and so on that goes in some different directions. So Merlin says, can you speak to the effects of an intensive meditation retreat once or twice per year compared to those kinds of shorter sessions daily? Is there anything known about that?
Yeah. So meditation retreats been found really helpful as well for people. So sometimes there's maybe 10, 14-day Vipassana insight meditation retreats that people go on. And they've been found really, really helpful as well. There's in addition to practices, people usually go in retreats and beforehand have done some practices before as well. So they wouldn't do nothing and go on a retreat. They would have done a regular practice probably leading up to that. Again, I think it becomes a question of accessibility, because not everyone can go on 10-day retreats and take 2 weeks off to go on a retreat, right? So that they're really great and they've been found to be helpful for people. But again, in a perfect world, people could be doing that. But again, that's not that accessible for people. And generally, people have found positive experiences with meditation retreats, for sure. Yeah.
So on the other, so a related question here, as with any intervention that we have for mental health and so on, is there a ceiling effect with mindfulness where repeated exposure diminishes its effectiveness? If we maintain the same dose over time, this is sufficient. Does the impact wane or become negligible over time? So can you, in essence, can you meditate too much?
Yeah. Too mindful. Absolutely. I think there's a researcher who's looked into this quite a lot in the US, Willoughby Britton, looking at adverse effects of meditation. It is, again, there's not if you do an hour a day every day, this is the prescription and then it goes down, your mental health goes down. That's not really quite how it works. A little bit more complicated than that because it depends on the person. But there are some adverse effects that people have found in mindfulness meditation. And so Willoughby's got a charity called the Cheetah House Charity where I talked about dose before as well. And it kind of really depends. So some people have negative experiences of meditation. So things like depersonalization or hearing voices a little bit, but usually they would have some other mental health difficulties already. Which is why another important thing is that we're also not thinking, don't put meditation on a pedestal that it can cure everything, because that's not what it's doing. And also thinking about, who the teacher is. Is someone qualified to help with those kinds of situations? That would be really important. Have evidence-based practices available for people. So there's a few different elements to that, but that wouldn't really happen with shorter practices, like 20 minutes or less. That wouldn't really be something people would be experiencing.
Right.
But here's a question from Joel, which is kind of, I think, coming from the experience of meditating and speaks to a kind of almost a potential confound in thinking about these things. So he says, if people are practicing alone, I assume you're relying on self-reporting. Do you think that people may sometimes not count some of their practice time if they haven't reached a certain perceived level of quietness in their mind?
Yeah, that's a good question. I mean, in psychology in general, or in research with these kinds of things, that it's difficult. How else would you measure whether someone is practicing? The person themselves is best able to report that. And there are some issues with self-report measures, absolutely, because you can't really look into their brain and see, oh, what is it you're doing, which would be interesting. But absolutely, we don't know. There's ways of counteracting that. So there's things that we can put into measurements to reduce social desirability bias, or that kind of memory bias that people are having. I developed one scale as part of some dose research before, but at the same time is also we want people to sort of really tell us what they were doing. So it's not a right or wrong answer. It's not too much or too little. It's just like, were you able to bring your attention back to the present moment after maybe your mind has wandered? So there's different things like that that we can do as well. But yeah, it would really depend on how people answer questions. A lot of the time we need to, questionnaire development is quite a lengthy process. It needs a lot of people involved. So this is tricky, but generally all the measures that are being used have been validated quite to a highest level of standard with lots and lots of people. So this is not just about asking one person, so there'd be hundreds or thousands of people that have done these measures.
Yeah. Okay, I think we're just about at the end of our time, which the conversation, lots of questions, I'm sure could have gone on for a lot longer, Sarah. So I just want to thank, on behalf of all the people joining the seminar today, I just want to thank you for your time and enthusiasm and your endurance, and not just doing a PhD, but lots and lots of really substantial research ever since.
Thank you. And thanks so much for having me on. If you have further questions, I could talk about this more with anyone.
Yeah.
Let me know.
If anyone wants to get in touch, Victoria University, is where Sarah's.